Hi, this is Will Miranda for the Fits on the Go blog. We're here live from Barcelona with Dr. Christopher Cannon, who'll be presenting the results of the ODYSSEY COMBO-II trial. Hi, Dr. Cannon. First and foremost, thank you so much for being here.
Sure.
First, we were wondering if you could give us a little bit of background information and also the methods of the trial.
Sure. Well, for cardiovascular risk patients, which were the subject of this study, using maximally tolerated statin doses, the current ACC-AHA guideline, but many of them will not reach the old guideline target of being less than 70. And so this study looked at exactly these patients. So 2/3 were on maximal dose statin. The other third had a good reason they couldn't be, were on a statin. And so looked at the current add-on therapy ezetimibe as compared with alirocumab, which is one of the PCSK9 inhibitors. We did it in a treat-to-target mode that we started with 75 milligram dose given every 2 weeks, and then if after 8 weeks it still weren't less than 70, then the dose got increased. So the findings were that the LDL was reduced by 50% with alirocumab and about 20% with ezetimibe, so highly significantly different. The LDLs went from a little over 100 down to 50 with alirocumab and down to around 80 with ezetimibe. The safety and tolerability was also comparable between the two therapies, and it was a year-long therapy, and the patients gave this on their own. And at the end of the year, 85% were still doing the injection. So I think encouraging on the tolerability of treating cholesterol with an injection.
So certainly very exciting results and promising ones. So where do you think we go from here in terms of further research and also clinical practice?
Well, this was one of 14 trials in the program looking at these type high cardiovascular risk, heterozygote familial hypercholesterolemia is another group, statin intolerance another one, and then cardiovascular outcomes, a large 18,000 patient trial. So there are other trials being presented here in these other populations, similar robust reductions in LDL. And so looking for clinical outcomes is one. One of the studies was of moderate size and had about a 50% lower risk of cardiovascular outcomes with small numbers of events, but encouraging to see that we're starting to see reductions in events with this different mechanism of lowering LDL cholesterol. So obviously more trials to come, but to have a further reduction to get LDLs down into the 50s or lower is an exciting prospect.
Yeah. So fantastic, sir. Once again, thank you so much for the
Certainly.
interview. And check our videos at youtube.com/fitsonthego.